Welcome back to the Johnson City Living Podcast. I'm Colin Johnson with the Colin and Carly Group and Keller Williams Realty. This is the place where we learn about the people, events, flavors, all awesome stuff that happens in our great region. And today I'm excited to bring one of our political candidates here so that you can learn about him, how he's been leading our area for years, how he's influenced our area, and what he's hoping to do as he runs for state senate. So welcome to the podcast, Dan. How are you?
Thank you very much.
For our listeners, tell everybody how we say your last name, because I don't want to say it incorrectly, but I've got Pohlgeers. Is that correct?
You got it. It's like flagpole and gears on a car.
Or pole position.
Yeah, pole
gears.
position.
I like it.
And I've heard it probably 60,000 different ways over my 60 years, but I'm okay with anything.
Yeah.
So,
yeah, and Dan's pretty simple.
Dan's
we can keep it pretty easy there.
Yeah.
First things first, Johnson City Living Podcast. What do you love most about Johnson City?
Oh gosh, I don't think it's just Johnson City, but I think it's the entire region, and entire area. You know, I moved here 31 years ago from the Charlotte, North Carolina area, Gastonia, North Carolina. And even back then, things were changing very rapidly. So when my wife and I decided to look for some place to move to, we really wanted to look for some place that had strong conservative values. For her, this was kind of a homecoming because she grew up in Bristol, Virginia.
Okay.
So this was one of the places that we looked. And fortunately, at the time, we had three healthcare systems actually here.
Mm-hmm.
I'm an occupational therapist and certified hand therapist by original training. And Wellmont had interviewed me. They had just recently merged at that time, 31 years ago. And then what was then just Johnson City Medical Center also recruited me and ultimately hired me to help start up their hand therapy program.
Oh, wow. Okay.
So this has been a great experience. I can't imagine living anywhere else.
Yeah.
I love the mountains.
Yeah.
I love the outdoors. Raised two children here, have two grandchildren here in the region. And it's just been a fantastic journey.
Yeah, it really is a great spot. I think everybody says the people, number one, the mountains, number two, seasons are good.
Yeah.
And then, just our opportunity here. And like you said, I think some conservative values. I think the Lord's calling a lot of people here.
Right.
And we just love people the way Jesus told us to do it, right?
Correct.
So how'd you get into healthcare back in the day? What was?
I was one of those people that when I first got out of school, I didn't even know exactly what I wanted to do. I didn't even know if I wanted to go to college. So I went to a small public university. I grew up in Kentucky, in the northern Kentucky area.
Yeah.
So I went to Northern Kentucky University, and I met this wonderful lady who really helped me. I took a 1-hour class in career development and looked at all of the options that were out there, and ultimately decided that based on my personality, that healthcare would be a good thing to do. And I decided on occupational therapy. So I transferred to Eastern Kentucky University and actually finished my degree there in occupational therapy. Met my wife at the time. Or she wasn't my wife at the time, who would soon be my wife at the time, just became very, very good friends and had a really good experience with that. And I was an occupational therapist for, probably 25 years.
Okay.
20 of those years, I was a certified hand therapist. So I kind of specialized in orthopedic. Just really enjoyed working with people and help people get through those struggles. And I think I like the challenge too, because I think the best physicians and the best therapists that you can see are the ones who use critical thinking skills and are able to kind of work through a process determining what level of care a patient needs, what types of modalities or what types of things they need. And I think that therapy really allowed me to do that. I think the best people in all healthcare are the people that don't treat people by cookbook method.
Right.
They have this toolbox of things at their disposal that they use to help people reach their final goals. And I've always saw that as really of a challenge type of thing.
Yeah.
Back in 2005, though, I decided that I wanted to get an advanced degree. So I went on to get my MBA at Milligan University.
Mm-hmm.
And that started a whole new challenge for me as an administrator and somebody who actually ran healthcare practices. So when Dr. Paul Gorman, at that time, I was actually working at Watauga Orthopedics. I had left Johnson City Medical Center, was working at Watauga Orthopedics when Paul decided to leave Watauga to start Trinity Hand Specialists. So it seemed like to be one of those kind of perfect fits. Since I was already in the process of getting a degree to do more management and more administrative types of things.
That's cool. Yeah. What are you doing today?
So right around, I guess it was around 2011 or 2012, I kind of felt like I had helped Paul to the point where his practice was really running by itself and was looking again for another challenge. And actually, he and I sat down and together, and really it was kind of his idea too. Maybe smaller practices, smaller medical practices, independent medical practices may not need somebody like me full time, but they could benefit from what I can bring to their offices on a part-time basis. So I started a small company, Sunesis Medical Consulting. Sunesis is Greek for bringing together or practical discernment.
Oh, that's cool.
Something that I always felt like I used in my day-to-day life. And so I started Sunesis Medical 2011 on a part-time basis. And by 2014, it was really kind of time for me to jump ship from Trinity Hand Specialist. They actually became a client for a short period of time. And then I started working with other small medical groups. And the advent of electronic medical records actually made it to the point where I could actually work with practices in Palm Desert, California, upstate Wisconsin, and never leave Johnson City.
That's cool.
And so I did a lot of that type of stuff. But then I started to kind of hone things down here over the last 6 or 7 years, just because lifestyle didn't feel like I wanted to work, had some family types of dynamic things going on, wanting to be able to help my ailing mother and then my ailing in-laws. So I kind of compress things to where I've become much more of a regional type of person.
Gotcha. That's cool.
But still very, very active with that business.
Yeah. What are some of the lessons you've learned over the years and all these leadership roles that would help, I guess, our listeners get to know you a little better?
Gosh, I'm constantly thinking about that. And I've got to say that my faith, probably is what drives me more than anything. I'm not sure there's any coincidences in the world. And I think you have to be open to the understanding and the callings that you have. And if you're prayerful and you're mindful and you are a true servant leader, those things just seem to kind of fall in place, kind of like the pieces of a puzzle. And I think that is definitely kind of my leadership subset. The thing that I enjoy the most is not my personal success, but the success of those people around me. If I can be working with a team and the team accomplishes their goals and I've been able to make all boats rise at the same time, that's a win-win.
Yeah.
I think for me.
100%.
Yeah.
What do you think some of the qualities are that separate good leaders from bad ones in your mind?
Well, I think the number one thing is just getting out and talking to people and listening. Even as a therapist, you can be sitting across from somebody and you have this idea, their diagnosis, the type of surgery they had, the type of injury that you've had. But until you start talking to them and listening to them, you really don't know what's going on with them.
Right.
And oftentimes, even as a therapist, I used to think to myself, the best skill I can have is being an active listener. Because if I'm listening enough, the person with the problem is going to better define what the problem is than I'll ever do with any type of evaluation tool.
Yeah.
And I think that even in my business, I do the same thing. We all have a tendency to go into different situations with this preconceived notions of how we're going to handle something. And if you go into that situation and you've already decided how it's going to be handled before you had the opportunity to listen and to talk and to understand the problem fully, you're probably going to be backpedaling a lot, and then you're going to have a lot of ground to catch up.
Yeah.
So even when I'm talking to a potential client or a physician group, I think having the opportunity to actually listen to them, talk to them, and work through the problems as they see them are the key and the goal.
Yeah.
And I think that's probably part of the reason why I've been so successful.
I agree. I mean, you've had a good career, and you, like you said, you're in a good spot. What's motivating you to keep going and to change gears a little bit?
Well, if my wife was here, she would tell you that I've kind of changed gears every 7 years. Although this last time's lasted a little bit longer, but not a whole lot. I mean, I think over the last probably year, or at least last 6 months, pretty intensely, we've just been seeing things in our community that we don't think are happening the way they should be happening.
Was there a decisive moment where you were like, I want to run and change this?
I think it probably was one of those things that over the last 6 months of prayer and prayerful discernment, I don't know that there's just one, but there is probably several.
Okay.
One of the things that I really kind of decided was, as my wife and I were talking about this, and we were hoping that someone else would pick up the ball or we could pass the cup to somebody else. When it became obvious that wouldn't happen, I was sitting there at our kitchen island of our, drinking a cup of coffee one morning, and she came out of the bedroom and she said, I've been thinking about this a lot, and I prayed about it before I came out here, and if not you, then who? And if not now, then when? I think you need to run. And prior to that, she had been a hard no. And so that was definitely one of those aha moments.
Sure.
Definitely. I had a couple aha moments when I spent some time in Nashville this year in the General Assembly and Legislative Plaza. I actually found a piece of legislation that would have closed down one of our ambulatory surgery centers in the area, Caring Hearts cardiac cath lab. There's a law in the state of Tennessee. It's called Certificate of Need.
Mm-hmm.
And it's something that I've been fighting against for the last 10, 15 years. Even the Trump administration, the DOJ, the Center for Medicare and Medicaid all say that Certificate of Need laws are barriers to access to care. And so the state of Tennessee, with the Trump Rural Healthcare Initiative, finally was starting to move in a positive direction on eliminating CON, or Certificate of Need, for acute care hospitals. And so I got a piece of legislation. I showed up there on a Monday night. I got a text from a lobbyist that I knew that the CON, the Certificate of Need law, had been published. Didn't have time to look at it that evening, but the next morning I was looking at it. It had already been passed through House Sub Health, and on the last page of that piece of legislation, there was a line that said, as of July 1st, 2027, all freestanding cardiac cath labs in the state of Tennessee must be affiliated with a hospital. And that was that word affiliated that I think made the difference. And affiliated means owned, operated, or partially owned.
Mm-hmm.
And so there is only one freestanding cardiac cath lab in the state of Tennessee currently. And it's right here in Johnson City, Dr. Jeff Schoondike. So I immediately picked up the phone. That was on March 3rd. Picked up the phone, called his CEO, texted both of them, asked them if they knew anything about it. And then I immediately started contacting some of our local House members that I knew sat on the committee that would hear this next. And it was that kind of coordinated effort between Highlands Physicians Incorporated, who had asked me to go to Nashville on their behalf, Caring Hearts, that we all started to kind of send messages out to patients people in the community and have them email members of our General Assembly, including leadership in the House and in the Senate. And then Representative Tim Hicks from Washington County actually proposed an amendment to carve out Caring Hearts, which ultimately saved that ambulatory surgery center. During the process of the next hearing, Rob Gregory had an opportunity to talk to House Full Health and give some actual numbers of the procedures that they've done since 2005. I think it was something like 866 procedures they were able to do in their cardiac cath lab. They estimated that in 2025, they saved Medicare and Medicaid $1.4 million, and they saved consumers $500,000.
Wow.
And at that time in March, they were already projecting that in 2026, if they continued on the path that they were on, now that they're fully operational and kind of hitting stride, that they would save Medicare and Medicaid about $2 million
every year,
and that they would save consumers about $1 million. And so this is something that's sometimes hard for people to understand. It is a very complex issue, but with Medicare and Medicaid, hospitals actually get paid more than these freestanding facilities that aren't affiliated with a hospital.
Why is it only Caring Hearts that's out there in the state of Tennessee for a freestanding cath lab? And then, yeah.
Very interesting, isn't it?
It is. I'm surprised. I would have thought, there would be a lot more.
Well, I think number
especially
one
in bigger
is,
markets like Nashville, Memphis.
Well, and I think there's, and I don't know what the result has been, but I know that there's somebody that's trying to beat that timeline, because the amendment actually didn't say Caring Hearts. It said anything in current, any freestanding facility
prior to
July 1st.
Gotcha.
So I know that there is there's a group in Memphis that's seeking it, but the certificate of need process is not an easy process.
Tell our listeners a little bit about that. And I know we don't want to get too deep in the weeds, but how did that get started? The certificate of need.
Well, it was actually something that Medicare and Medicaid decided back in, I think, the 80s.
Okay.
And the idea is very similar to how we were kind of sold the merger of Mountain States and Wellmont.
Mm-hmm.
The idea is if you control access and entry into the market, you're going to eliminate duplication of equipment and services,
which would drive pricing down,
improve quality.
Right.
That was the goal. But after less than 20 years, it was obvious that this was not happening. So it's one of the few times that a mandate like that was reversed. And so they did not require states to have a certificate of need law. Many states have already repealed all of their certificate of need laws.
Oh, wow.
I believe there's 33 states that still have some sort of certificate of need, but Tennessee has really been slow to do that.
I was going to say, do you see us as a state getting rid of it in the future, or is that something you're running to try and work on?
That's definitely something that I'm trying to run to.
So you're running for state senate. We haven't talked about that yet.
Right up for state senate.
And voting it's now. Like we could vote. Early voting lasts until Friday, right?
Yep. Early voting lasts actually Saturday.
Okay.
August 1st.
Okay.
And then the actual primary date is August 6th. So I'm running in the Republican primary against 36-year incumbent Rusty Crowe.
Gotcha.
Who has not had a primary opponent in 20 years.
Oh, wow.
And and as of right now, there are no other people running.
Okay.
So this primary, this Republican primary, should determine who our next state senator is.
Gotcha. Okay.
Yeah.
That's pretty impressive.
Yeah.
Yeah. So what are some other things besides the certificate of need you're wanting to change as you gain election? Let's say you're elected. Like what's on your docket to try and help Tennessee become better, or our region become better?
Well, I really think that, and this is something that I've been kind of advocating for the last 8 to 10 years. When the idea of merging two large hospital systems like this started to be discussed, I immediately started doing research on how this transpired in other parts of the country. And I was one of the few voices at some of the public hearings that the state of Tennessee held that actually stood up and said, this is not a good idea. When you have this type of vertical integration of healthcare systems, large healthcare systems, that vertical integration oftentimes leads to poor quality, higher cost, problems with physician recruitment and retention, problems with employee retention and recruitment, and that overall the healthcare system suffers and the people in the community suffer. Even though I was one of the lone voices here locally, I was not one of the lone voices across the country, because at the same time when the Tennessee General Assembly was trying to change the law to allow the COPA to occur, which is basically a fancy way of saying estate action immunity from antitrust. There was 86 healthcare economists from Ivy League schools, Georgia Tech, Stanford, that were all saying, they all signed off on a paper that this was going to be detrimental to people in our community. The FTC came out, the Federal Trade Commission came out very, very hard against this also, and said that the state of Tennessee was making a mistake for allowing this to happen. But it had tremendous political push from the get-go. We were promised things like decreased cost by eliminating duplication of services. We were told that hospitals were going to stay open and that the hospitals would continue to operate like they were. And almost immediately, as soon as the monopoly took over, they started stripping services out of some of those hospitals and bringing them here to Johnson City, which I think is problematic. It's even problematic with our current healthcare push, the Trump Rural Healthcare Transformation Initiative, where the push is to make sure that rural areas of our country patients are able to get the care that they need, right? And the actual term is right place, right time, at the right price.
Right.
And so eliminating CON is actually part of the Trump Rural Healthcare Initiative. States that have CON are gonna receive certificate of need, are gonna receive less federal funding than states that have eliminated CON.
Gotcha.
Does that make sense?
Yeah, totally. And I remember someone I was hearing that Wellmont was financially in trouble, and they were, part of the reason for the merger was to, not allow those hospitals to go down and that whole group too. Was that part of it as well, or?
That was definitely part of the PR campaign and the push. But I think even the Department of Health was surprised by how well both hospitals were doing when you looked at their consolidated financial reports.
Gotcha.
And even had discussions with the Department of Health even back at that time during those public hearings.
Yeah.
So, I guess it's a double-edged sword. Do you sacrifice the free market to save a failing system, though? Also, and what are the consequences and results of protecting that failing system? But I don't think that would have happened. I think that there would have been safety net things put in place. I think that there would have been things that would have been put in motion to save those failing hospital systems.
Yeah, it is interesting how we just have the one now, right?
Just have the one.
And are you since the merger? Is there hard data that's showing that it got better, or which direction is it going?
Well, the Centers for Medicare and Medicaid have a star rating system. And since the merger, Johnson City Medical Center has been a 1-star facility out of 5.
What was it before the merger?
I think it was always right around 3 or 4.
Okay.
And Franklin Woods, I think, is a 3 now, a 3 out of 5.
Okay.
But post-merger, it's struggled too, but now has improved. So
Okay.
give credit where credit's due.
Sure.
And then the rest of the hospitals in the network, I believe, are all twos.
Okay.
2 out of 5. But that 1 star puts them in the bottom 6% of hospitals nationwide.
Oh.
Hospitals that are compared on the same data. And it's just not Medicare data. It's some Centers for the CDC also has some input into that. As far as things like hospital-acquired infections, hospital-acquired injuries, those types of things are really kind of some of the driving forces. All of the hospital systems up here, 20% of their grade comes from patient surveys.
Mm-hmm.
And I think Johnson City Medical Center, it's either a 2 or a 3 this year. So that actually improved their score, but they still weren't able to climb out of that 1-star rating.
And if you're elected as state senator, is that one of your things to try and help change?
Well, I think the biggest thing is that we really need to make sure that we're building an environment here that is welcoming to another hospital system.
Gotcha.
Having a monopoly makes it a really, really tough entry point because of their control. But with elimination of certificate of need and maybe incentives, or I don't know exactly how we do that, but if we're able to get a hospital system coming into this market, this isn't about destroying Ballad, because we need Ballad and we need the hospital system. A hospital system here.
Oh,
we need 2.
yeah.
We need 2.
Okay.
But if we're able to restore free market health care, Ballad becomes better.
Gotcha.
Competition makes everybody better.
Sure.
And I think that both hospital systems pre-merger were doing much better on quality and cost than they are right now.
Gotcha. What are some other things you want to work on besides the healthcare sector as a senator?
Well, I think there's a couple things going on. 8 years ago, when Governor Lee first introduced, the idea of parental choice in schools, that really sounded like a great idea. But as we've progressed and as that has become reality, I've started to see some things that are really, really concerning to me. Just this year, they increased the school voucher program from 20,000 children. They increased it by 15,000. And again, this was one of those things. So now we have 35,000 potential school vouchers. But again, this was one of those things that we were promised something that I'm not sure that we're getting delivered on. The promise was to give parents and children, impoverished children, an opportunity to get out of an underperforming school and receive a private education.
Right.
Yet 65% of the kids that are receiving those vouchers were already in private school. And then you look at District 3, which is who Rusty and I will ultimately represent, Washington, Carter, and Johnson County. And you have to ask yourself, are Carter and Johnson County, are they better off because of the school voucher program? Are they able to even participate in the school voucher program?
Probably not, right?
Is there a family in Johnson County that feels so strongly that they want their child to go to private school that they're willing to drive to Washington County every day, an hour and 15 minutes, depending on where they're going?
Right, yeah.
And then also just the cost. I'm not a big government guy. I don't think conservatives should be big government. Just like conservatives shouldn't be for monopolies.
Right.
Conservatives shouldn't be for increasing the size of government.
Sure.
And this price tag is somewhere about $400 million. We've increased the size of government by doing this. And then just this year and just less than a month ago, the committee that oversees where funding goes just rubber stamped a new contract with a company out of Indiana that is going to run the portal or website, in other words, to where parents can actually apply for vouchers. And they just renewed their contract And so over 5 years, that company will be paid over $600 million to run that portal. I'm not sure that that's a really good use of taxpayer funding.
600 million just to run the portal, or it flows through the portal?
Flow through the portal and to make those decisions as to who qualifies. And so that's still an awful lot of money over 5 years.
Mm-hmm.
And I'm not sure that the taxpayers, even those who agree with vouchers, realize that an outside company, a company, by the way, who's in trouble with some of their other states because they're not fulfilling the contract that they've signed, I'm not sure that people who are voters in the state of Tennessee should be really, really happy about that.
Yeah.
Something else that the General Assembly did this year also with the expansion was they increased the threshold or the max, the cap that a family of 4 could make and still participate in the voucher program. It's almost $175,000 per year now.
Yeah. That's not an impoverished family, probably.
No.
Right. Agriculture on rural area. We live in Appalachia and in mountain cities, pretty rural, right? In Carter County as well.
Yeah.
What are you hearing from farmers and kind of the rural area on how, what do they need to
well, I'll definitely tell you, this is one of those things that's not my strong point.
Gotcha.
but even on my website, I actually state, I think one of my strengths is I know what I know and I know what I don't know.
Yeah.
And so when I meet with farmers and I've met with quite a few in Washington, Carter, and Johnson County, I usually start out with, when it comes to cattle farming, I can sum it up in one word, what I know: steak. But at the same time, I think it's important, and I think it's important that they know that when a piece of legislation comes across my desk, or an agriculture, something that has to do with livestock or farming,
right,
when it comes across my desk, I'm not going to really listen to a special interest group.
Yeah,
I've got no funding from special interest for my campaign.
Yeah,
I'm not beholden to special interest.
Right,
and so I'm actually having these meetings with a purpose to develop kind of that network of people who I think know the answer and know how this is going to affect their livelihood and how they run their farm, whether it be an environmental type of piece of legislation, or how livestock are treated, or how they're slaughtered, or how they're processed. I want to hear from the farmers. I want to hear from the people who are actually doing it, not a lobbyist, not a special interest group. And my pledge to those guys is that I'm going to actually come back to them when those types of things come up. There's a good chance that I may be on the agriculture committee in the Senate.
Yeah.
If I'm fortunate enough to win, because we are so agriculturally based here, I might wind up on that committee. So I'm going to have to know.
It'll be a quick study, I'm sure, and having lots of great people around to teach you all about it will be.
But I also, as a therapist, as an occupational therapist, I had to learn a broad spectrum of disease processes. And so when I decided that I was going to become a certified hand therapist, I had to all of a sudden now take all that energy and learn something new. And not only learn it, become an expert at it so that I could pass a very, very difficult exam and actually call myself a certified hand therapist. And then as I decided to go into business and want to be more on the administrative side, I just didn't decide that I'm going to hang a shingle and say I'm now an administrator. I went back to school, got my MBA, studied, learned stuff. And I've also learned stuff and have used mentors along the way. So I don't think it's that big of a stretch to think that Dan Pohlgeers, who has his focus on healthcare, can't help rural farmers and agriculture and everything else that economically we're dealing with right now. But I will tell you also, those same folks that I meet with, their biggest concern is healthcare.
Yeah. As an entrepreneur too, small business is a big deal, right?
Yeah.
And what are some things that you see where Tennessee can help small businesses, or our region can increase small businesses, or maybe even develop as part of your role? I would assume you're probably into, economic development on some levels and bringing more industry here.
Well, that's a huge topic of discussion, especially in Carter and Johnson County. And Johnson County actually has made some pretty big strides. I don't know if if you heard about it, but EAA Firearms is moving to Mountain City.
Tell me about EAA.
EAA is European American Arms.
Okay.
And they actually have a whole line of pistols. They're a company that's originally from Turkey.
Oh, wow.
I think the gentleman that is either a partial owner or a full owner of it now is from the United States, and he lives in Johnson County on a temporary basis and loves the area and loves the people, and has decided that he's going to move part of his production to Johnson County. But in addition, there's going to also be additional parts plants that are coming.
Okay.
I believe, and I've had multiple discussions with people in Carter County, that there is a lot of empty space and a lot of empty manufacturing. And, what can Carter County do, and how can the General Assembly help? Those are all things that are going to be tremendous learning curves. I do remember 31 years ago, and I think that NAFTA was one of the driving forces for the departure of some of these companies. But when I moved here 31 years ago, we had Levi Strauss, we had Superior Wheels, we had Empire Furniture, A.O. Smith, American Water Heater is still here, and they're still doing very, very well. But we need to get back to that type of light industry types of things. And I think that should be driving our economic recovery. And I think that the Trump administration is trying to do things to bring some of those jobs back that left our area 31 years ago with NAFTA.
Got it. What gives you hope about the future of Tennessee and our region?
Oh, they're just great people here.
Yeah.
Hardworking, independent. I was at a meet and greet last night at Roan Mountain. Multiple people there at this meet and greet were telling me stories like the fact that they were 5- and 6th generation Tennesseans. And, one gentleman was in his 90s, 7th generation. So his family was here before Tennessee was a state. And I think that these are people who are hardworking, fiercely independent, love their country, love this community, love the mountains, love the things that we enjoy here, that other people are now wanting to move here to also enjoy, like I did 31 years ago. And so that's my biggest hope. And I believe also that these folks have very, very strong, conservative, spiritual lives. And I think that is equally important too.
Yeah, I agree. You ready for the rapid fire round?
Sure.
Coffee or tea?
Coffee.
Yeah. Morning person or night owl?
Morning person now, but that's recently changed the older I get.
Yeah. That's funny. Favorite local restaurant?
Golly, that's tough. I like Southern Craft.
Yeah, it's so good.
And I tell you, I like Phil's Dream Pit too. I'm kind of a barbecue person.
But
I tell you what, there's a guy up in Kevin Long, up in Shady Valley that has a barbecue food truck. And if you ever see, I think it's called Uncle something. I wish I could remember the name of the truck, but if you ever see that truck,
stop.
You got to get the barbecue nachos.
Oh, that sounds delicious. I love it. Favorite place in Northeast Tennessee?
Gosh, I have a place up on Iron Mountain, and it's just so peaceful. I love Johnson City. I love Boone Lake. Spend a lot of time on the lake, although I haven't had much time this summer on the lake.
Yeah.
But I do like Boone Lake. I tell you, I don't know that I have a favorite. I think Johnson City actually affords many opportunities.
It really does.
As far as restaurants and nightlife and things to do, shows, those types of things. But then you look at things like the festivals and stuff that all three areas have.
Yeah.
Last year, for the first time since we purchased that place up on Iron Mountain, long before we decided to run for office, we started to attend like we went to the National Fiddlers Convention in Mountain City last year. And so all 3 counties have tremendous things.
Yeah.
Cover Bridge Days are fantastic. Music on the Square in Jonesboro.
Yeah,
so that's not really rapid, but I'm sorry.
That was good. No, that's okay. That's okay. One word your family would use to describe you.
Gosh, I would say consistent.
I like it. Historical figure you'd love to have dinner with?
Oh, Thomas Jefferson.
Oh, man.
Actually, I was talking about him with my brother earlier today. I think our founding fathers were just absolutely brilliant men. And I think Thomas Jefferson was a brilliant man.
I agree. Favorite Tennessee tradition, or you could say Pohlgeers tradition. What do you guys like to do?
We love to do, our family, my wife and I have been married for 35 years. And for 35 years, we've gone to choose and cut Christmas tree farms to get our Christmas tree. And we've made an entire day out of it.
Yeah, we do the same.
And we haven't missed it.
So much fun.
Right before my daughter was born, she's now 32 years old. I was in the hospital, but my wife still went with our neighbors. We were living in North Carolina at the time.
Yeah.
She still went with our neighbors to go ahead and do it. So, at least that part of our family, and she was pregnant with my daughter at the time. So at least that part of the family actually kept that tradition, even though I was sick in the hospital.
It's so much fun. Just going and getting your own tree. We can just go just right up the mountain.
Right.
It's awesome.
And we usually do some shopping and usually go out to lunch and just spend the whole day together.
We do a little of the same. Anything that some people maybe are misunderstanding about you'd like to clear the air about?
Well, it's interesting. I think that there's been some people out there that think that somehow I'm not running in the Republican primary.
Oh, wow.
And I've heard that from some of my poll workers. So I think the big thing is just understand that Rusty and I are both Republicans. We're both conservative. We do have some differences. There's definitely some healthcare issues that are different between us. But I think that's probably the thing that people misunderstand most about right now, anyway.
Why should I vote, or why should a listener right now? We've got 9 days till we vote, right? What should they do to make a great decision and choose you?
Well, I know it's a big leap of faith.
Right.
I'm somebody that, even though I've been involved with political campaigns, I've been involved with political activities. My wife and I were the area coordinators for 6 counties here in 2014 for Pro-Life Amendment 1. We started a 501c3 to help area pregnancy help centers. Even with all that, even with all my background in healthcare, I've never held political office. But I think that there's one thing that I also think is equally important, talking about founding fathers. I don't think our founding fathers ever intended for us to have career politicians.
I was going to say term limits, or how do you feel about that?
I think term limits are something that should be looked at, but I really think that if whether or not you believe in term limits or not, if you're a true historian of our Constitution, a true historian of our Declaration of Independence, none of them, Jefferson included, John Adams included, served more than 12 years.
Right.
And so I think I will self-impose term limits on myself of no more 8 to 12 years. This is a 4-year term. And so I think the fact that Rusty's been in office for 36 years, and he's not had a primary opponent in 20, I think it's time for a new perspective.
Yeah.
Even in my professional life, I started a 501c3. I was the chairman for 6 years. But after 6 years, I really believed that it was time to get somebody else in place. And not only did I step aside as chairman, I actually stepped aside from the board as a whole, because I knew whoever the board decided to replace me with, they were always going to question that person's authorities, even as I was sitting on the board.
Yeah.
And so I've done that with other boards and committees and things that I've held also. So I'm consistent with that.
I love it. I love it. I probably know the answer to this one, but if someone remembers only one thing from today's conversation, what do you want that to be?
Pohlgeers.
Pohlgeers. Vote for Pohlgeers. I love it. I love it.
Consider voting for Dan Pohlgeers.
Yeah.
If you live in District 3, which is Washington, Carter, and Johnson counties.
And yeah, I think in the voter turnout's been low.
Has it been?
Well,
it's actually been pretty high.
When you start looking at our population,
well,
I mean, we're only like,
historically, Washington County has not done well.
What's up with that?
10 to 12%.
Yeah.
This year, I mean, we have a contested primary for governor.
Mm-hmm.
We have three candidates for governor. You have a contested primary for state senator.
Mm-hmm.
And so our numbers are a little bit higher even than they were 8 years ago, the last time that we had a contested governor's race. And so I'm hopeful that people are excited about this and excited about the possibilities of potential change, and that's partially what's driving them out to the polls.
Yeah.
So our numbers have actually been a little bit better here in Washington County. Carter and Johnson County, I guess if you want to do a little healthy competition between the folks in Washington County and Carter and Johnson County, Carter and Johnson County have always had pretty high voter turnout.
Okay.
Regardless of the race. And so Washington County really needs to step up to the plate. And as the largest of the three counties, we need more than 11% of the registered voters to vote. This should be something that you consider a God-given right.
Well, and it used to
and
be
a responsibility.
and it used to be, I think the voter turnout was a lot higher. Is it just that we've gotten busy, or they feel like maybe there's no reason to vote because we can't change anything? Or
could be all those things.
Yeah, a lot of stuff.
Yeah.
Well, thank you so much for coming on the podcast. I wish you the best. I'm glad that the Lord has called you to run, and I'm praying that you win, and let Him just lead and guide you every day to make our area better, because I think that's why it's such a special place. The Lord is just, He's got His hand on us for sure here.
Oh, yeah.
So,
most definitely.
Yeah. So I'll be praying for you. Get out and vote. You can we've got early voting until this Saturday. This is coming out maybe tomorrow or Friday. I don't know when it's coming out. So, but get out there and vote. Thank you for listening. Share this. Let some people learn about Dan, and spread it out on the socials, and click on the link, subscribe, just spread it out so that people get to know Dan a little bit better through our conversation. Thank you so much.
Yep. August 6th.
August 6th is the voting day.
It's the last day that you can vote. That's the primary day. And we will know that evening who our next state senator is going to be.
Yeah, that's exciting. Well, at least you'll know pretty quickly, right?
Right.
Yeah. Well, thank you for all your hard work. Thanks for coming on the podcast.
Thank you.
Wish you the best. Thanks. Have a great day.
Thank you.